Just ahead on Black Issues Forum, keeping kids safe from COVID and getting ready for child-safe vaccines. What a major climate change report means for Black communities, and Charlotte's step forward on non-discrimination. Stay with us. Welcome to Black Issues Forum. I'm Deborah Holt-Noel. In the coming weeks, North Carolina public school students will start filing back into classrooms in person. Adults continue to argue the merits of vaccines, masks, and distancing. Meanwhile, a vaccine safe for children is underway. Once it becomes available, however, will parents be ready to make the vaccine decision for their kids? I'd like to welcome family and general medicine practitioner and co-owner of Durham Family Medicine, Dr. C. Nicole Swiner. Dr. Swiner, thank you so much for being here.
Thank you for having me. Good morning.
Let's talk a little bit about your background, because initially when the vaccine came out, you yourself, even as a physician, had your reservations. Tell us what convinced you to go ahead and get the vaccine for yourself.
You're absolutely right. The ones that we know of now, Pfizer and Moderna hit the market sometime in December of 2020. And we'd already been through this crazy year of the pandemic and misinformation and back and forth and all the things that we were just trying to figure out on the fly. So when the vaccines made their way to the U.S., saw it on national TV, happen, that first person get the vaccine, I was a little, I had questions. I had questions. And so I wanted to know as much information as possible. I wanted to know the safety. I wanted to know how the vaccines were made. And to be honest, I waited probably 2 months after that to get my first dose. I ended up getting Pfizer.
Research. You did your research. You
absolutely.
Had your circle of friends and colleagues.
Had conversations with people that were in the lab, involved heavily in the makeup and the manufacturing of the vaccines. Absolutely.
Terrific. Now let's talk about kids and vaccine. The current vaccines are safe for individuals aged 12 plus, and scientists are working diligently toward a vaccine that's going to be safe for younger children. Some pediatricians, however, are urging the FDA to reduce the follow-up period for testing to 2 months rather than waiting the regular 6-month period. So we've got this Delta variant hanging out there, and it's spreading rapidly. So what's the conversation in the medical community concerning reducing this waiting period and the safety of the upcoming kid vaccine?
Yeah, when I talk to my patients, many of them are parents, and I see a lot of kids in practice, and I have 2 children myself that are already back in school that are under the age of 12, so they're not able to get the approved vaccinations at this time. I would say it's about 50-50. About 50% of the people that I talk to, both in clinic with my patients and with my medical colleagues, note that they are excited. They're excited to have the opportunity to have their kids vaccinated because they want to protect them as much as possible, as soon as possible. The other 50% are a little hesitant, just as hesitant as some of them were with the adult vaccinations. They are for their children, just in terms of the side effects and the long-term complications that might, be related to them.
Let's talk about efficacy of strategies right now. So we've got masking available, people talking about that. We've got a vaccine available for adults, and people are talking about that. What is your understanding of the efficacy of masking? How does that protect not only the young person, the student that's in the classroom, but everybody else? Talk a little bit about that, particularly with regard to the tiny particles and the aerosols that, can't they just get into this mask?
So it all depends on the type of mask that a person is wearing and if they are wearing it properly. Mask wearing absolutely is effective, absolutely, in the prevention of transmission of the virus and the prevention of becoming infected. So for instance, my kids, going back to school, we've now encouraged them to double mask, and we've purchased surgical masks. You certainly can look for N95s or KN95s that are thankfully thankfully now widely available. In the beginning, we were, scrambling to find PPE and protective equipment, but now you can find them online or go into your stores and they are readily available. But my family is back to double masking now just for extra protection. I would much rather you wear a mask of any sort than no mask at all, and certainly make sure to cover your entire nose and mouth.
Got you. And so when that vaccine becomes available for kids, people are going to go through this battery of choices and decisions and just concern again. Can we feel fairly confident that enough research has gone on and enough testing's been done that it would be indeed safe?
I would still have some questions. I know that, like, as you mentioned, some pediatricians or some in the medical community are pushing for that FDA required time instead of 6 months to be 2 months. I think we thankfully have a good amount of information from the adult and adolescent studies that we've done for the vaccines that are currently available. So we do have some that can transmit to, our children. But I don't know. I'm kind of in between. I'm still on the fence, and I'm going to be honest with you, because I am a mother, So the doctor part of me says I'm very excited for there to be vaccines available, period. The mom side of me, I don't know if we'll necessarily be first in line, but we'll certainly end up getting vaccinated. I know my husband is very, very, he's very interested in our kids being as protected as possible. So
certainly. And with regard to that decision, it is a choice at the end of the day that you have to make for your kids. But let's talk also about the choice that parents are making to go ahead and send them back into the classrooms and how that's beneficial for their mental development and what parents can be doing to make sure that their kids are emotionally and mentally solid as they, go into this new school year, maybe a little less prepared than last year because they've been out for such a long time.
Right.
What are they needing?
Right. So my kids have been extra excited and hyped about getting back in with the classroom with their friends and being, seeing their faces, So what I'm trying to do is trying to balance my excitement for them and my, my happiness that they're able to be in that social setting with, teaching them to be cautious. I also don't want to give them too much, panic or anxiety about what's happening in the world. But so I think we have a healthy balance. If nothing else, you really just have to encourage your kids to keep their masks on. I know it's going to be really hard, especially for young kids, to remember the importance of keeping that mask on and trying not to be, too close all the time to their friends.
Is that psychologically, excuse me, is that psychologically damaging to be wearing the mask? Some people are worried, they're having to wear a mask and they're feeling inhibited and unwanted and that kind of thing. What are your thoughts about that?
I don't think so. I have an 8 and a 10-year-old, and they are at this point, they're pretty much professionals at wearing the mask. And I don't think it's inhibited their interaction with their friends at all. I think being in person is always better than being on a screen. So the fact that they're in the same room with their peers, I think makes a huge difference. So no, I don't think a mask gets in the way of them being able to appropriately have good psychological connections to their friends. I don't think that.
And in the last few seconds, for those who have made that choice not to get a vaccine, what's your best advice for them to keep themselves safe from COVID as well as others?
Yeah, so I've been using this metaphor since the beginning of the pandemic. I actually borrowed it from a patient, a war veteran, told me this. He said, if we're at war and you're going outside, why wouldn't you wear your bulletproof vest, right? So why wouldn't you protect yourself? Yes, you may still get injured, but at least you have a better chance of survival. And that's exactly the way I feel about the vaccine. We've had months and months and months, over a year of evidence and research that the vaccinations do work, that masking does work. So please do those things. And if you have any questions or concern, ask your medical professionals. Do not rely on the internet. Do not rely on what your friends are telling you. Please talk to your trusted medical professional and have that conversation.
Dr. C. Nicole Swiner, thank you so much for your time and your advice.
Thank you.
This week, the IPCC Intergovernmental Panel on Climate Change released a report with grim news for our world's future unless there's swift and dramatic action to control climate change. For decades, influences on climate change have had direct and devastating impacts on communities of color. So let's get some more perspective from our panel. And I want to welcome political analyst Steve Rao, Lemicia Whittington of Advanced Carolina, and Dr. Danielle Purifoy, Assistant Professor in the Department of Geography at the University of North Carolina at Chapel Hill. But first, I want to share that right here in North Carolina, we have our own challenges with the kinds of emissions that are culprits in negative climate change, namely gas and methane from hog waste. I mean, we like our bacon, right? Governor Cooper recently signed into law Senate Bill 605, which allows the Environmental Management Commission to develop a general permit giving hog farmers permission to build and operate farm digesters. Of this legislation, State Representative Jimmy Dixon of Duplin County, the top hog-producing county in North Carolina, said this bill is a common sense approach to maintaining a safe, economical, sustainable supply of food in North Carolina. Senator Jay Chaudhary of Wake County opposed the bill, however, saying that he believes there is a real environmental justice component to the North Carolina Farm Act. Now, this bill, once again, they said, is a common sense approach. Let me get on to our questions. I want to open up with you, Dr. Purifoy. What are your thoughts on policies for climate change that affect not only the climate, but predominantly Black communities? What's happening there?
Yeah, so thank you for having me. So this bill is really damaging for a number of reasons. First, the idea that biogas is some form of sustainable or renewable energy is just false. It is predicated on years, decades really, of really toxic hog industry practices of saddling Black and brown communities with hog waste. And now the idea is that you are going to take that same waste and turn it into energy. And this idea that it's renewable is predicated on the existence, right? The continued existence of these toxic industries that have for so long sprayed waste directly on the homes of Black and brown residents who are living nearby these facilities, contaminated the water supply, and so forth. And so actually opening the door, right, for this kind of blanket general permit for these anaerobic digesters really opens the door towards the increased proliferation of these farms, which we actually right now have a moratorium on. And so there's nothing renewable about it. Furthermore, biogas is basically methane and carbon dioxide, two of our three top greenhouse gases that contribute to climate change. So if we're actually interested in what the IPCC is saying about climate change impacts, we actually need to go in a different direction altogether in terms of alternatives to fossil fuels.
Thank you so much. And you know, what you're saying is not disconnected to some recent action with regard to infrastructure legislation. Steve, Congress is on the verge of passing yet another infrastructure package. AOC fought hard for a Green New Deal, and progressives faced a lot of criticism for pushing for a Green New Deal. How would you say climate change addressed this most recent iteration? And do you think that the timing of the release of the IPCC report will give some leverage to Biden's effort to get this $3.2 trillion plan passed?
Well, first of all, I think it's a great first step and achievement for this Democratic president to achieve bipartisan consensus and get a deal done, the $1.7 trillion, which is going to, basically upgrade our bridges or roads. It does make some initial investments in green energy, which I'm going to talk about in a minute. But the bottom line is this new UN report was a shocker. I mean, in terms of the fact that we're in code red. And, we have two options in the United States and around the world. We can continue to pump carbon gases into our atmosphere, and we'll see more droughts, more fires, putting 1 billion people on our planet at risk of, just severe weather. or we can make significant changes. And it's really going to take big investments. So I do think that this will give us better leverage for having more of a Green New Deal in this democratic $3.5 trillion blueprint. And I'll just give you a couple of examples. For example, the president wants to expand to about 500,000 electric vehicles and reduce carbon emissions in the United States by 50% by the year 2030. We only have 43,000 charging stations. So I like the $3.5 trillion plan that's basically saying instead of only investing $7 billion, we're going to invest $37 billion for electric vehicles. We're going to invest $198 billion for clean energy. We're going to do another $135 billion for reducing carbon emissions, reducing forest fires. So the amount of investments are significant, and it's going to take those kinds of investments to address climate change. And it does tie into the first question about minority communities, because at the end of the day, it's about job creation, creating new jobs for everybody, addressing racial equity. And, the fact of the matter is that if you don't have clean water and if you don't have clean air, many of these minority communities don't have a voice. And, people are losing their homes. California lost 500,000 acres in a fire.
Right.
So anyway, I hope, Yeah,
and I'm sorry to cut you off,
No.
but you were beginning to connect the dots for us, and I wanted you to, Lamisha, continue to connect those dots, because some would say, listen, we've got natural disasters that are happening, the world is evolving, Mother Nature does not discriminate, so why are we trying to tie racism and equity to climate change?
Right. So the impact of what we're looking at with climate change didn't just happen overnight. So when we talk about the historical grounding of this nation, let's talk about plantations that were actually the same form of corporations today. There was industrial plantations that had enslaved people on it, that were tobacco mills, cotton mills. It actually did the same emissions. We don't discuss that. Those plantations and that same land was then converted into newer industries post-emancipation. That means the same poison, the same toxin that was put in the soil, the same emissions that were happening from those plantations were now corporations. And so what we're looking at is areas like the Black Belt in East North Carolina, other rural communities that are most marginalized, communities of color, they are also living in the area. They're the descendants, right? So guess what? These corporations built on former slave plantations, they're still paying slave wages to the Black descendants of the ancestors who were enslaved on that same land. And on top of that, these dirty corporations, as Dr. Purifoy already said, it's an honor to be up here with you, these corporations are killing the same communities through these emissions, these harmful poisons. We are number 1 and 2 in the nation for corporate hog industrial production. We have more hogs than people. It's 40-1. That's capitalism, racism combined. And I do want to give honor to elder and now ancestor, Miss Elsie Herring, who fought until her last breath against these corporations and won lawsuits against a large corporation. The manipulation of this farm bill, let's be very clear, it has nothing to do with small family farms. I come from a long line of rural farmers. This has nothing to do with family farms or small farms. These are large industrial corporations who were tired of the people protesting and winning lawsuits. And this bill stops and halts certain permits, so it limits how much the people can actually wage lawsuits for the filth that they have put in our communities and the emissions that is adding to the climate emissions, which is what's making the United States number 2 in the world for the worst greenhouse gas emissions. That's where it's tied.
So when we talk about greenhouse gas emissions and the Green New Deal, so forth, Dr. Purifoy, bring it home to North Carolina. Share with us a little bit of what's happening right here in our state, right in our own backyards, that really demands the Green New Deal, perhaps, and certainly some dramatic measures toward more green practices.
Sure. So as you just heard Lamisha say, one of the things that's really important is that we have this massive industrial agricultural complex, right? That's not just hog farms, it's poultry farms, and you can't even call them farms, they're factories, right? That are guised as farms. Those are really massive contributors to climate change. People talk about energy, and that's certainly number 1 and really important for us to think about, but agriculture is very close behind energy in terms of in terms of production of greenhouse gases. So what that means, in addition to these acute impacts that communities are experiencing through water contamination, air contamination, that impact them acutely on a day-to-day basis, long-term, those are the same communities that are going to be impacted by things like flooding, right? The way that segregation has worked historically in our communities is that Black and Brown communities have been placed in floodplains, right? Which means that when we have these catastrophic weather events, there's going to be more flooding. In cities, one of the ways that this manifests is through, for Black and Brown communities, is through things like heat island effect. So there's a lot of impervious surface, concrete, right?
Right. And then the effect,
right.
and once again, I'm sorry to interrupt you, one of
That's
the
okay.
other impacts is on our health. And so then you have health disparities that are affected by unclean energy practices. And we only have about a minute left here, but I want to bring you back here, Steve, to talk about this Green New Deal and what the investment in that might mean for Black and Brown communities.
Well, I think it's going to help Black and Brown communities because, you know, if you aggressively invest in dealing with addressing this climate change, you are going to provide better, cleaner air, cleaner water, and in poor communities, and also housing. You know, if you lose your house through a fire or a terrible storm, how are you going to rebuild your house, your community, and in the middle of a pandemic as well, as we're still dealing with raging Delta variants. So these Black communities are so affected by climate change, and I think what this Green Deal does is make these investments. You know, we are looking at, you know, I'll end with this, you know, one of my favorite books is Bill Gates' book on climate change. I never thought I would see the founder of Microsoft talk about how he's invested over $2 billion in climate. Everything is going to change. More plant-based meats, less impervious surface, where we dine, you know, how much parking is going to be there, because all of these things are producing so much carbon in the air. And, you know, I think we're going to really have to incentivize our nation and also provide more to other countries around the world. You
Absolutely.
know, but the Black communities are really affected by this.
And each person and each nation is going to have to do its part.
Absolutely.
This week, the city of Charlotte turned a corner from its old HB2 days with a vote in favor of a new non-discrimination ordinance. It goes into effect October 1st. Dr. Purifoy, what do you think this ordinance effectively means for the city of Charlotte and its reputation?
Well, I think it goes some part of the way towards mending the reputation of the city. I noticed that there are a few other cities actually in North Carolina that have passed similar non-discrimination ordinances. I think, you know, really honoring the basic dignity of LGBTQ communities is core at ending violence against, for instance, transgender women that we've seen, Black transgender women in particular that we've seen. So I think it's positive, and we still have a really long way to go before we see the full dignity realized for these communities.
So far, reports seem congratulatory. Steve, what are your thoughts?
First of all, I'm not so concerned about Charlotte's image. I mean, I commend them for having the courage of any city to take on discrimination of any sort, particularly those of the LGBT community. There are other ordinances that currently prevent employers from discriminating on race, gender, and ethnicity. So I don't see a problem with it. However, the challenge is, you know, under the law, right now, cities they get all their authority from the state. So we know where this could head, where, you know, basically they pass an ordinance, it gets struck down in court, the General Assembly could go in. That's how HB2 happened. This isn't as overreaching as what, you know, initiated HB2, the whole HB2 situation. But, you know, I think it does come down to, you know, if you can't win the battle, is it worth fighting the fight? If we know that the General Assembly would go in and strike it down. And clearly, I think what has to happen, in my opinion, is cities shouldn't be in this position. A city, whether it's Charlotte or Raleigh or Cary or any city in this great state, shouldn't be afraid of passing ordinances that are fighting against discrimination, like Dr. Purifoy said. It's the right thing. But what has to happen is the state of North Carolina has to make sure that LGBT and these things are protected statuses in our state constitution, in our state law, so that it wouldn't be illegal for a city to pass this ordinance. So in my opinion, we need a new Speaker of the House, we need a new Senate Majority Leader that are Democrats that would support that and make that happen in North Carolina.
LA, what are your thoughts on it?
I'm really absolutely in agreement. Last year's federal law change around the Title IX is what allowed for the discrimination clause, non-discrimination clause to actually be a reality, because that's what persuaded the majority of the city council in Charlotte to vote for that non-discrimination order. Okay, this was 5 years after the bathroom bill, which was a national plague and a shame. It was $400 million plus lost for our economy and job loss that has now, we feel the resounding impact even more so in pandemic, in addition to targeting transgendered people. In addition to this non-discrimination order, it also protects familial status, pregnancy, veteran status, and natural hairstyles. These are non-discrimination clauses that should have been added a century ago. We're behind times. And so here's the thing though, while it is great, it is largely symbolic if there are no enforcement components. Right now, there's no enforcement. So it's symbolic. So what is symbolism going to get us beyond performative distraction? So we have to be very clear in the honor of Jada Peterson and Remy Fennell, right, to Black transgendered women who were murdered. We have to be very clear there needs to be enforcement for us to actually ground what it means not to be discriminated against. So we have a long way to go, but I'm glad this is at least the first step.
Absolutely. Lamisha Whittington, Steve Rao, and Dr. Danielle Purifoy, thank you so much for your time today.
Thank you.
Thank you.
I want to thank all of today's guests. We invite you to engage with us on Twitter or Instagram using the hashtag Black Issues Forum. You can also find our full episodes on pbsnc.org/Black Issues Forum or listen at any time on Apple iTunes, Spotify, or Google Podcasts. For Black Issues Forum, I'm Deborah Holt-Noel. Thanks for watching.
Quality public television is made possible through the financial contributions of viewers like you, who invite you to join them in supporting PBS NC.